And the first thing that we're going to do is go over just the general Health Information Exchange, or HIE, definition. Then we'll jump into really talking about the Vermont HIE, or the VHIE, and the building of the VHIE components. Then we're going to talk about linking all of the information together across the VHIE, really referring to the master patient index. Then we'll talk about the future functionality, what we're planning to roll out in the VHIE, and then we can jump into questions. So the first part is just defining Health Information Exchange, or HIE. And this really can be thought of kind of in two ways. So you can have a little grammar lesson and think of it as a noun or as a verb. So when we talk about the noun, we're talking about the exchange. So we're talking about a secure computer network that connects various health systems and enables sharing of data. So we're talking about an actual physical entity. We can also talk about the verb, or to exchange, and in that case we're talking about transmitting data across the noun. So basically you can say, I'm exchanging on the exchange, or we exchange on the exchange. So sometimes it's helpful to kind of think about, what are you actually talking about? Are you talking about the noun form or the verb? So when we jump into the actual Vermont HIE, or the VHIE is the designated Health Information Exchange, or HIE, for the state, and the VHIE transmits health information. So we're talking about the noun, which is the VHIE, and we do the verb, or we're transmitting information over that and that structure. And this presentation primarily focuses on the VHIE, or the noun of HIE, and the building of its components, so the actual architecture. If you attended the summit and you saw Sandy's presentation, or if you didn't, Sandy followed this presentation, and he was basically talking about the verb. So I described the setup of the VHIE, and he talked about how do we exchange clinical data across the VHIE. So then we jump into the big picture of the activity that's going on in the VHIE. And the first time you see this picture, it's okay to freak out, be scared. There's a lot going on here. It's meant to kind of show that it is a complex system. You will see this at the end of the presentation, and by that time, hopefully, you'll be able to have a better grasp of the components. From a big picture perspective, we have a lot of connections, so that's one thing to kind of notice about this diagram. The second is that we have arrows pointing in different directions. So we have arrows that are pointing to the VHIE, and you can see the VHIE is marked here. So we have arrows pointing to and from the VHIE. Most of the green arrows are showing we're sending data to. The purple is showing where we have connections from. And then we have other entities. And so what you can also see is that we have multiple types of connections kind of around pointing to the VHIE. And we'll talk about those different types of connections. And the other thing that you should notice, just kind of from a high level, is that we have solid lines, and those are things that are live in production today. And then we have dotted lines that basically those feeds are in some sort of testing mode. And I don't think a lot has changed since the last time I presented this, but just be aware that there may be some slight changes. So that's kind of the high level, and we're going to talk about how do we put all of these different pieces together. Now, before we talk too much about putting them together, what I wanted to talk about was the format of the data being transmitted. So when we're actually exchanging data, the verb form, on the VHIE, we want to talk about what would we actually see. So if you were to kind of tear the VHIE open and peek inside, what would you actually see in there? What kinds of data are getting sent around? And the standard that we follow is HL7, or Health Level 7 standard. So you may see data in different formats. The HL7, there are different versions. There's version 2 and version 3, and I'll go over in a little detail of those. But if I can use the analogy of sending an email, so just like when you send an email and you go in and you send an email and you put in your email address and a subject and a body, those are all fields that are defined. So if you try to put in your email address, the person you want to send the email to, if you put that in the subject, your email isn't going to go anywhere. It's just going to be stuck. If you put an incorrect email address, it's going to get bounced back. If you put different things in different fields that don't belong there, it's just not going to work. And so that's really what we're trying to accomplish with HL7 standard, where there's an acceptable format. It says you must put these types of things in these places, and when you do that, they will be accepted. If you do not, they will be rejected. Sometimes there are warnings, sometimes there are hard stops and errors, but that's the kind of thing that we're talking about. So for the standard that we're following for HL7 version 2, we use this for transactional type events. So when we have an update to patient demographics, so we might have a new patient registered in a system or an update to them, we might have a lab result, those kind of one-time events that we track over time. We usually use version 2, and you can see the thing to think about version 2 is that it's pipe and hat or caret delimited. So when you see the different fields are separated by pipes. And so there are different standards, or there's a standard that says, okay, you must always put the patient's name in this field, the last name, first name, date of birth, gender, that kind of thing. And so when the sending system puts it there, the receiving system knows to look in that place to get that information. And then the version 3, this is really where we use it. We use it for clinical summaries, where you might not have a one-time event. You might have a whole summary of information, all of the lab results for the last 60 days, vitals, etc. And so this format, version 3 is XML based. So if you're familiar with XML or HTML, you'll see tags, and so it looks different. It has a different flavor. So if, as I said, if you were to open up the VHIE and look inside, these are the types of things that you'd be seeing flying back and forth. So now if we actually get into the building of the components, when we, as an HIE team, are trying to build the VHIE or add more to the VHIE, we're primarily talking about building connections to healthcare organizations that do one or more of three things. One is we may make connections that provide data, and we call these the data providers. When I say provider in this sense, I don't mean a physician. I mean it's an entity or an organization that's actually providing data to the VHIE. We can also set up connections that receive data. We call these data receivers. Or we can set up connections to registries, and they aggregate and report data. So we're talking about these types of three connections that are at a high level. And these connections, when we make them, they're basically a combination of secure connectivity and interfaces to transmit the data. So obviously we need a secure channel or tunnel so that we're securely sending patient information. And then the interfaces, you can think of interfaces as export utilities from EHR systems. Basically, they export the data or receive the data. Basically, an interface, when we talk about interfaces for the VHIE, we're talking about two sides. There are always two sides, a sending system and a receiving system. So we set up those interfaces. So first I'm going to talk about the secure connectivity, and then I'll jump into how we set up these interfaces. So the recommended connectivity options are one of two things. The first one is what we kind of casually refer to as the agent. This is also the Mid-City, our HIE vendor's iNext platform. This is the preferred connectivity option, especially for practices. It's very easy to install. It's just a little application that you can install on a PC or a practice server, and you install it and you can fairly quickly get connected to the VHIE. This is also an inexpensive way for practices to get connected. In the past, we had set up some virtual private networks, which is the second option, and oftentimes you have to maintain a VPN device, you have to pay to set it up, you have to pay maintenance. So from a practice perspective, the iNext platform or the agent is very nice because they don't have to worry about the cost. So the second option is the virtual private network, or the VPN, and we use this mostly for high volume connections or situations where we can't do the iNext platform. We generally use this for hospital connections, labs, and vendor hubs. So those are our secure connectivity options. And now we're going to talk about those three types of connections that we make. So the data provider, the data receiver, and the registries. So first, the data provider. So as I mentioned before, these are entities that provide data to the VHIE. So you can see, this is kind of a zoom in on that gigantic diagram that I had shown before. You can see that the arrow is pointing to the VHIE, so they are sending data. So we have labs, we have hospitals, we have practices. They are sending data to us. They are providing data. And hospitals, so some examples of this, as I mentioned, hospitals, they can provide patient demographics, lab results, radiology results, transcribed reports, all of those things. Oftentimes, we have labs sending us. These could be hospital labs, or they could be commercial labs sending us data. And then, as I mentioned, the practices, they can send us patient demographics, clinical summaries, immunizations. Those are all of the things that we would consider them providing data to the VHIE. Now, when we set up a data provider, so these organizations that are going to send data to the VHIE, we go through a set of steps to ensure that the interface works, is functional, and when it goes live, it will have low maintenance. So the very first thing that we do when anyone comes to us and they say, hey, we want to connect to the VHIE and we want to send data, we say, have you looked at our technical specifications? So we have a site on our website, and it's a place where all of our technical specs are located, and it's vital.net/specifications, and vendors can go there. Usually we point the EHR or hospital system vendors there so that they can write their interfaces to the specifications. Once they say, oh, yep, we've written our interface, we're all ready to test, we're ready to go, we say, okay, so let's analyze some of those messages that you generate from these interfaces. So when I say messages, they're looking like those messages that I talked about, the HL7 version 2 and version 3, so the pipe and hat and the XML. So we say, okay, give us that data, and then we analyze them. We fill in a questionnaire, and the questionnaire is often based on the workflow. So could you possibly have patients that have the same medical record number in your system? Have you ever done a legacy system import? Technical information about the messages themselves, basically trying to tease out any gotchas early in the process so that they don't come back to bite us later on. So we do that questionnaire, we analyze the actual messages, and then based on that, we submit them to our vendor, and our vendor Medicity builds the interface. So the interface itself ends up being a set of modules, and each module is can be kind of thought of as a processing stack. So it goes through multiple steps. So we might do an initial validation of the data that comes in. We might have to transform the data. We need to parse it and write it to our patient databases. And so this is what it actually looks like, and it's processing messages. Once we have that interface built, then we say, okay, we're ready to actually receive the messages. So we've set up the connectivity, we have a secure connection, and the sending system or the data provider sends the messages over the secure connection, and we run them through this interface. And this is an example of what one of those messages might look like. And once we test that message receipt and everything's okay, then we say, okay, we're ready to go live with the interface. Now, as I just described it, that was a very smooth, it seems like it's a smooth process. There are often issues that come up when trying to make these connections or to these organizations that are providing us data. Oftentimes the first one right off, a site or organization will say, we want this interface, and right off the vendor says, sorry, I don't have that interface to give you. So they have to go back, and maybe they say we're never going to do it, or maybe they say, oh, that's in our development queue. There can be all sorts of reasons why they don't have it. Once the vendor actually has that interface and they can send data in what they think is the right format, many times they send us data and it does not comply with the technical specifications. So they may say it does, but then it comes back and we say, okay, well, it's not in the required format, you don't have the specified data elements, you're not meeting HL7 version requirements. There can be all sorts of reasons where we have to tell the vendor, go back, you have to make corrections before you can connect. The issues that we're talking about here, these types of issues meeting these technical specifications, which seem pretty basic, often translate to delays of months to years. This stuff, especially if a vendor doesn't have an interface available, that's something that often has to be added to a development list, prioritized. If they don't have a lot of customers asking for it across the nation, many vendors won't even consider it, or they put it on a very low priority list. So that's just something to kind of keep in mind as we're talking about when we're making these connections. And when I talk about vendors, I'm talking about vendors that support EHRs and hospital and lab information systems. So what are we talking about when we say data providers? As I mentioned, what realistically, like what's really happening with the VHIE today? And when I say today, I should actually say what were the numbers in September, because I think this slide was actually created then. But this is fairly close to where we're at. For hospitals, we have I think 11 of the 14 hospitals, or 10 of the 14 hospitals in Vermont connected to the VHIE in some shape or form. They are providing data to the VHIE. And then on the right side, we have organizations submitting data to Blueprint. So in some shape or form, these organizations are sending data to the Blueprint registry. So we talked about the first type of connection, the data providers. Now we're getting into the second kind of connection at a high level. These are the data receivers. So these are organizations that receive data from the VHIE. Now remember, organizations can be both. They can provide and receive data. That can often happen, especially with practices. So we're talking any entity that receives data from the VHIE. So again, we zoom in on that big diagram that I had shown you previously. And we're looking right now just at the VHIE, and we have results coming back, and it's the direction from the Vermont Health Information Exchange to the practice, back to the practice's EHR. And the most common example of a data receiver is that the practice receives lab results. So it's a practice that receives lab results. They can also receive radiology results or transcribed reports, such as discharge summaries, but the most common right now is probably the lab results. So we're going to go through a similar process that we did with the data provider. When we connect a data receiver, the very first thing we do is we say, can you comply with the technical specification? Again, if they can't, it goes back to the vendor, and the vendor needs to do work in order to comply with that specification. If we make it from there, the vendor says, okay, yep, I'm ready. This part, the data receiver part, is, I would say, a more standard flow. Many vendors are fairly well versed. If they've done one lab results interface, they've done many. This is really basically rolling out lab results, radiology results, and transcribed reports to practices, and many vendors have been doing this for a while. So this part of the process tends to be easier and faster. What we do is we take, once a vendor says they're ready, we then take this practice planner, and in that practice planner we say, okay, the hospital that you want to connect to is connected. They're sending lab results, they're sending microbiology, they're sending blood bank, they're sending general labs. Which labs would you like? And the practice can choose, oh, I just want general labs and I want micro, but I don't want blood bank. We fill that in, we load in the providers, so the actual physicians or clinicians who are going to receive the results, and then we install and configure the iNext platform. So we talked about the iNext platform being used for connectivity, and so we do that, we configure it so that practice can actually receive lab results from us in a secure fashion. And then once that's installed, we test the message receipt. So we actually send some test messages from a hospital, and the EHR vendor verifies that, or the practice verifies that the messages have filed appropriately. And once we're finished with that, then they say, yep, we're ready to go live. So this process tends to be faster, although not, I suppose not always, but lately it seems to be going faster. So again, common issues when we're connecting these data receivers. The first thing, like I mentioned before, the vendor might not have the interface available. They might not comply with the specs that are posted on our website. Another one that is not always obvious but can actually put a stop to interfaces. The storage or display of the data by the vendor results in a non-ideal workflow. So we've had situations where, yes, the vendor can support a radiology result interface or a transcribed report interface, but when the results file into the EHR, it's hidden in this weird place that a provider would never go to see it or not know that it's actually there. So obviously, if it ends up if it creates a bad workflow for somebody and no one's going to actually find what they need, usually what that means is that the EHR vendor has to do development, and it's actually application development, not interface development. They have to develop their application to support or improve workflows. Again, these kinds of issues can translate to delays of months to years. On this side, the data receiver side, VITL does have a little bit more flexibility to tweak messages for the data receivers. So we receive all of the data from the data providers. So hospitals send us data, and we try to normalize it a little bit. And then when it comes out, sometimes the receiver or the EHR, the receiving EHR says, I can receive everything that you're sending me, but I'm really having a problem with this one field. Can you do something about that? And we do have a little flexibility to kind of tweak it and massage the data so that it fits nicely into the EHR. So again, what does this look like when we're talking about the VHIE or the Vermont connectivity? Here's a picture of healthcare organizations receiving lab results from the VHIE. And again, this was taken in September, so we've had a few more rollouts since then. But this gives you an idea of who's connecting, who's receiving, and kind of the pockets around the state that we have connected. I think we have a few more connected in the middle of the state, and some duplicates, I think, especially in the Springfield area. Okay, so we talked about, I mentioned that there were 3 types of connections. The data providers, so they provide data. The data receivers, they receive data from the VHIE. And then the third type are the registries. So we have VITL, or the VHIE has basically 2 registry connections. One is to the Blueprint registry, and this supports Vermont's Blueprint for Health program. That connection is live. So if we look at the zoom in of the big complex diagram from the beginning, we have the VHIE, we have the Blueprint registry, and we have a connection from the VHIE sending data to the Blueprint registry. That is live. For immunization, we also have a second connection, registry connection to the immunization registry, and right now that is only in testing. So that is not live in production. The connections, for anyone who knows me, I could probably go on for days about the information about connecting practices and organizations to the registries, how they're set up, how they're configured. There's a lot of detail that goes into this, but I will not do that here. I will summarize it as the healthcare organizations that submit data to these registries through VITL. So what's off the page here are possibly hospitals and really practices who send data or provide data to the VHIE. We follow that data provider process for those entities, and then we have additional review steps and coordination with each of the registries to say, okay, we've validated that everything is filed into the VHIE okay, now we have to go and make sure that it also files to your system correctly. So what might be certain values in the VHIE might not be the same values in the Blueprint registry. So it's basically like almost implementing 2 interfaces per rollout when you're doing these registry connections. So that brings us back to the big picture. So hopefully we talked about the 3 types of connections, the data providers, the data receivers, and the registries. So if we look back at the picture, when you first saw the picture, you probably thought, oh my gosh, this is so crazy. And then now that you have a little bit more information, we can kind of go through where here are some data providers where we have arrows, green arrows going to the VHIE. Hospitals, commercial labs, and practices are sending data to the VHIE. So they're providing data. When we talk about the second type, the receivers, so the purple line where we have going from the VHIE back to the practice, we have data going there and the practice is receiving it. And then we have the registry connection. So with the VHIE, we have the immunization registry and the Blueprint registry. Now, some of you may be asking, oh my gosh, why did she include all of this extra detail in here when I'm just really looking for a high-level picture? During this presentation, I really wasn't sure what kind of audience I might have, and I definitely had a variety of folks. So everyone from just learning about HIE to they had rolled out HIEs. So I included the extra detail for the really technical folks, but really tried to point out that just at a high level, just follow the arrows, the directions of arrows, so that you can kind of see how all of the pieces fit together. So one of the last things that I wanted to go over before going through future functionality is, okay, we've built the VHIE, we have all of these different types of connections, and what do we do? How do we link information across the VHIE? So we have patient demographics coming, we have lab results, we have radiology results, we have clinical summaries, everything is flowing in and out of the VHIE. How do we link it all together and make sure it links back to a patient? VITL has a master patient index. We also call it the MPI, and this links the data for a patient together. We do this we have matching algorithms that are updated and exist and are updated to accommodate Vermont demographics. So maybe we have a lot of a certain type of last name in Vermont, and so we have to tweak our matching to make sure that people aren't incorrectly matched together. And so I'm not going to go into a ton of detail with all of the algorithms, but I wanted to use the picture that I have here as an example of as we all know, at VITL, we have two people who have really similar last names, I should say full names, and we're from the same graduating high school class, and so we have close to the same date of birth, and we have similar demographics, and yet we would not be matched in the VHIE because we have exact match rules on our first and last name, and we have different date of births, and so that would be enough to say, yeah, you're not the right person. So as you can see, Jen Morgan and I would not be matched together. So let's talk about future functionality for the VHIE. We have the first thing really is basically doing more of the same. We need to increase the footprint for both number of connections and types of data, and we are doing that, and we continue to do that. This current footprint again was in September. So I know that we have more connections since then, but you can kind of see the distribution of lab results with Blueprint, and the really amazing thing is that the green little markers. That means that we have multiple interfaces at the same location. So there's some combination of we're doing both Blueprint and lab results and or transcribed reports and or radiology results. So that's pretty amazing to see so many markers with green, and I know we have even more with green today. So the idea would be that we fill the green mountain state with green. So another way to look at this is because a greener map of Vermont may not be super exciting to folks. The other way to look at it is what are we talking about in terms of numbers? Here's a graph of VHIE services by our status. So when you look at this, we see the dark green is live. So you can see how many services we have live, and that's in terms of practices. What's really interesting is that all of the non-dark green, that's all work that VITL has left to do. At least that's the known work that we have yet to do. I'm sure there are more sites that we have not put on our list yet, but this is the known work that we have yet to do. And there are different stages. So some of these services are in progress. So those are probably more likely to happen sooner than later. But there are many things that you can see are not currently supported by the EHR, or more importantly, not currently supported by the hospital. So it's really hard to give a practice lab results electronically if the hospital that they usually receive them from isn't sending them or providing them to the VHIE. So many times we have to work to make sure that the hospitals are providing that data first, and then we can connect those practices up. So more future functionality, some of the other things, just kind of at a high level, we're looking at setting up a bidirectional connection with the immunization registry. Obviously, we have to first send immunizations to that registry, but we definitely have on our radar to set up a bidirectional connection. We've also talked about CCD, or continuity of care document exchange, so essentially exchange of clinical summaries. We have a provider portal in the works. We are planning a consumer portal, and we're working to support radiology imaging, or DICOM. And these are just some things. Again, these are kind of in the works. They're to be determined in the development stages, but these are the types of things that you can expect coming from VITL.